and welcome to Parenting Corner on Therapy Cable. I'm Dr. Parie Baharian, and this is...
Dr. Nicole Chavez.
Thanks so much for coming today.
Yeah.
So today, you want to let them know what we're going to talk about?
Right. So today in our first segment, we're going to talk a little bit more about postpartum depression. It's going to kind of be a little bit of a heavy topic, so just to let you guys know, bear with us. But, last week we talked a little bit about some of the risk factors for postpartum depression and anxiety, and we want to talk a little bit more about symptoms, and then we're going to go into one symptom in particular that we want to let you guys know about.
Yeah, and even though it might be a bit heavy, it's a really important topic to discuss because I think we all have heard about it, in one way or another from the media and things like that. And now we're here today to kind of talk about the real deal, what it really is, what the research shows, and that way you guys can get some good information. So it'll be heavy but important to talk about.
Mm-hmm. So we're just going to start basically with some of, the symptoms of postpartum depression. And sometimes they're very similar to depression that doesn't happen in pregnancy or after giving birth of a child. And some of those symptoms are, depressed mood most of the day for nearly every day. And with depressed mood, it can be sadness, tearfulness, irritability, and anger are some of your big features. There's also guilt, and those can be guilt around a lot of different things. And with new moms, a lot of times that guilt has to do with not being a good mom or not feeling she isn't taking care of the baby or taking care of the house or being a good wife or a spouse or a partner. There's a lot of guilt around that. And then there also tends to be a lot of worry that goes along with that. So some anxiety about not doing the right things or not doing it good enough.
Right.
Trouble sleeping.
Oh, right.
Is usually big, especially if baby is sleeping and you can't sleep.
Oh, man.
That could be a sign of anxiety or depression.
Yes, that's a good point. Sometimes, you could even have thoughts of wanting to hurt yourself, suicidal thoughts, and that can be really scary if that happens. That's a really good indication that some depression is going on, and it's a good time to seek help.
So sometimes our appetite is affected. We may not want to eat because we don't feel good, we don't feel like eating, or we may overeat. Sometimes we all know about emotional eating. Sometimes eating makes us feel better. And we've all done it, but in depression this can occur much more frequently, and sometimes it can be associated with weight loss if we're not eating, and weight gain if we're eating too much.
Yeah, and you just lose your energy to do things.
Right. And not only do you lose your energy, you just don't want to. Nothing sounds fun. Nothing sounds enjoyable. You may not even want to hang out with the baby that much.
Right. You just feel like there's this cloud in your head, and you just can't. It's like cobwebs inside your head, and it's just so hard to think clearly, to do things clearly, to just have this sense of, I just don't want to do it. Like you were saying. Right.
And I know that we've all heard about the baby blues. And this is very much different from postpartum depression.
Yes.
And a lot of women experience baby blues. Probably, a good 85% of women experience baby blues. And as a mom myself, I went through some baby blues and, know what that feels like. And it's a very, different thing. And
how long do those last, Nicole?
They usually start about, 2 days after the birth of baby and can last anywhere from, 2 to 3 weeks.
Okay. Okay. So it's a shorter time frame.
It's a very short one.
Okay.
And anything after 3 weeks, you're likely looking at postpartum depression or postpartum anxiety.
So at that 3-week marker, that's what we really want to look at as being maybe more significant.
Yes.
More of a problem.
And the symptoms are definitely less severe, let's say. With the baby blues, you might get weepy, start crying for no reason, just kind of out of nowhere. But overall, your mood is going to be happy. With postpartum depression, your mood overall is going to be depressed. You're going to kind of stay in a low. Or with the baby blues, you might go kind of up and down, but overall you're happy, you're excited about baby, you're doing things with baby, you've got your energy levels. Aside from, the sleep deprivation.
And general overwhelming feeling of having a new being in your life. Yes.
So if you're feeling depressed and it's interfering with your kind of ability to take care of yourself or take care of baby, You might want to, talk to somebody, talk to your partner, talk to your doctor, or seek out a therapist that might be willing or be able to help you.
Right. You're not alone, and this can really happen. What is the statistic, Nicole, about how many women experience postpartum depression?
They say 1 in 8 new moms experience postpartum depression, or about 10 to 20% of new moms will experience a postpartum depression or anxiety.
Right. So, it is treatable.
Yes, absolutely. You can get help. If you get help, you can get better.
Yes, and we're here to help, and you're not alone.
Yes. So last week we talked about perfectionism as a risk factor. And this can also be seen as a symptom. Sometimes, we want to do things right all the time. And so that's something to be watched out for if that's happening. And then one of the symptoms that we want to talk about that is experienced with a postpartum, mood disorder that you're probably not going to experience with other types of mood disorders is what we would like to call a scary thought.
Yes, this is really important.
Right. And they're called scary thoughts because when moms experience them, they are very scary. They're very disturbing, and a lot of times when you have them, you don't understand what's happening. So a scary thought is something that is an intrusive thought. Something that we don't think on our own or usually wouldn't think, but kind of just like all of a sudden it's there and it kind of like comes into our head, and it's very intrusive because we don't want it there.
Right.
And can be sort of obsessional. They may happen over and over a number of times throughout the day.
Yeah, you just can't stop thinking about it, even though you just desperately want to stop thinking that thought. Yeah.
These thoughts are generally have to do with something happening to baby.
Yes. Even maybe the baby's going to get hurt. Maybe it's something like, I'm going to drop the baby, or I'm going to kill the baby. Oh no, I'm so worried about the baby, and checking on it multiple times per day.
Right.
Just making sure that the baby's okay.
Right. So some of the common thoughts, and there are many, many different kinds that you can have, and they may be about yourself. They may be about your spouse or your partner, but largely are about the new baby. The most common ones typically involve stabbing the baby, putting the baby in the microwave. Again, like Parie said, like the baby falling, or the baby, you dropping the baby from various places. And then worries about touching the baby inappropriately. So, and then there's fears around wanting to change baby's diaper or give the baby a bath, because women are feared that they're going to touch the baby in a sexual way, and that they're not meaning to. So with scary thoughts, we don't want you to be too alarmed. I know they're scary, again, because you don't know where they're coming from. And the reason they're scary is because you know as a mom that you would never do any of those things to your baby. You would never want anything to happen to your baby. And they're likely going to be causing you a lot of distress. And what we want you to be aware of is this does not mean that you are going to hurt your baby.
Right. That's a really important point. And I think that when you think these thoughts, you might think, I am the worst mother ever. I can't believe I even have a baby. I shouldn't be a mother because I'm thinking these thoughts. However, and I totally get it. That would be an understandable response, and at the same understandable women have thought these thoughts that are having this type of experience with postpartum depression.
Right. So women who have postpartum depression or anxiety, particularly postpartum OCD, it's very common for them to have scary thoughts.
Yes.
And again, the same with depression. Scary thoughts. This is treatable, and this can get better if you get help.
Yes.
Okay. So along with scary thoughts and in the intrusive kind of obsessional type of thought, there are some thoughts that are also intrusive and obsessional that aren't as scary, but still kind of get in our way. And these may be thoughts about, is the baby getting enough milk when I'm nursing him? Is the baby's breathing? And so these thoughts may be happening just too much during the day, too much worry. And again, these are getting in the way of your ability to kind of take care of you. So if you're worried that baby isn't breathing and you're checking on him like every 5 minutes, especially in the nighttime when you should be resting, this may be a little bit too much worry, and there may be a little bit too much anxiety. It might be a good idea for you kind of to examine what's happening and maybe get some help or let somebody know what's going on for you.
Yes, and it's not an indication that you're not a good parent if you need to get some help. If you're getting help, that means you're trying to be a better parent or you're trying to help. And there's no shame in seeking help.
And again, the reason that we want to share this with you is because, we want you to be well.
Yes.
And we know sometimes this kind of stuff doesn't get talked about.
It's often like people just think, oh, you have that mothering instinct. You'll just have that instinct and it'll all go fine.
Right.
How did that go? I mean, I know for you did have some struggles maybe in the beginning. And even though you might know what to do in some situations, sometimes it can be really overwhelming.
It is. It can be really overwhelming. There's a lot happening. It's a huge adjustment. Like, all of a sudden, like, your whole world kind of changes. Yeah. Everything about who you are is completely different. So it's a lot of adjusting, and you do need help. You can't do it on your own. As much as I wanted to do it on my own, that's just wasn't really possible or wasn't really realistic. At least not for me. It wasn't. I needed help. I needed to ask people.
Yeah.
Hey, can you come over so I can take a shower?
That's a great idea to kind of seek support from those around you.
Right.
In order just to do sometimes daily activities, normal things.
Right. Because sometimes you just can't do it all. And you're right, Parie. A lot of people think, like, well, you're a mom now. You should just know what to do. Well, no. No. That doesn't always happen.
No, definitely not.
Unfortunately, I think people aren't talking about depression after new baby, and so people don't know it actually exists, and so when people experience it, they're afraid.
Yes.
Because people get these comments like, oh, aren't you so happy?
And isn't it worth it?
Yes, that was my all-time favorite. Let me tell you. When I would talk about how tired I was because I was up all night, nursing a baby who wanted to eat every hour and a half.
Oh, my gosh.
I would get but isn't it all worth it? Well, at that moment, I wasn't really sure. I was tired, and I just wanted to sleep. And I loved my baby, don't get me wrong.
Of course.
But
that doesn't mean you don't love your baby.
No, it doesn't.
No.
I just needed some support, and I needed someone to understand that being a new mom isn't always peaches and cream.
Right.
So
the way it looks sometimes on the media, where it's just beautiful and everything's great.
Everything's always happy.
And right after birth, you're going to look like Kate Middleton. Right?
Right. Wouldn't that be great?
I know. Wouldn't that be nice?
Yes. Well, sometimes we have to work for things.
Yes. Right.
Well, so, so it's not abnormal to not be happy all the time. And if you feel like something isn't feeling quite right, seek out help, whether it be from another new mom that a support group, your doctor,
yes.
Or you can always, check out our website, again, www.postpartumrelief.org. We provide different types of services, and we have lots of different types of resources that may be helpful to you.
Books on there as well. And I know sometimes moms can be different. They want to kind of read up on it first and see how it fits them and what they need. And everybody needs a different type of help. So, that we have some books listed on there, some articles that might be really helpful for you to read when there's all that time, extra time available, right? Yes.
Right. Or even other websites that we have listed on our website with more information, more resources, coping skills, places to find the different things you need. Therapy, support groups, group therapy, whatever, again, like Parie said, may fit for you.
I think that's the important part. There's not just one way to get some help. As long as you're getting some good help that's helping you out, that's what matters. Yeah.
Right. And like we said in the beginning, even though this was kind of heavy today, it doesn't have to be. Again, if you seek out the help you need and you speak up, you can get better. And it can be much more fun and much more happy.
And we would encourage you to do it earlier rather than later, because I think that we can definitely help, or there might be other things that can help you, when you just go in earlier rather than later. But it's never too late to get help either.
Right.
Mm-hmm. Awesome.
So I think that does it.
Right, and I think, as it is a very heavy topic, and if you have any questions, please go to our Facebook page, Parenting Corner,
right,
and leave us some comments or questions. I mean, I know that they might be pretty personal, and that's fine. We can keep that confidential on the air, and it, might be a good time for you to kind of ask those questions that might be weighing on your mind. That would be the appropriate place to do it, or just send us an email. Yeah.
Okay. Sounds good. Well, thank you for joining us for this segment.
Thanks for coming.
All right. And we'll be right back with our next segment.
My name is Dr. Sagert. I'm a board-certified psychiatrist. I can provide medication management, psychotherapy, either individually or in group setting, and also I provide couple therapy. I have experience working with severely mentally ill patients, as well as substance abusers and highly functioning people. My website address is www.drsagert.com.
Hi, and welcome back to Parenting Corner on Therapy Cable. I'm Dr. Nicole Chavez, and I'm joined by
Dr. Parie Baharian.
So in our last segment, we talked about some postpartum depression and some of the symptoms of postpartum depression, specifically scary thoughts. So if you missed that and you would like to know about it, please check it out. Again, it was a little bit heavy, but now we're back to do some parenting stuff with our young kids, probably about 10 and under. And this one's going to be a little bit more light, a little bit more fun. As you see, we've got the toys out.
Yeah, we've got the toys right here.
We're ready to have some fun. So Parie's going to start us off.
So today we are going to talk about some skills you can use with your child when they are saying or doing things that are not okay and things that you may not like. So on a previous segment, we talked about 3 skills you can use with your child when they're doing something that you like. And those skills were praising, when you praise what they like, what you like about what they're doing. So you would say something like, "Nice job playing gently with the toys." And then we also went over a specific description, which is describing what the child's doing with their hands when they're doing something that you like. So if they're picking the toy up gently, you would say, "Nice job picking the block up, picking the blue block up." And then the other one was reflection, and that's just really repeating what the child's saying and when the child's saying something that you like. So that could be just exactly repeating back what the child's saying and maybe using better grammar or something like that. So you're modeling for them better vocabulary. Now, we did allude to it in the other segment about how when they're saying something you may not like or whining.
Yes, whining.
Yes.
That's a good one.
Then we alluded that the fact that you could just avoid that or ignore that.
Right.
And so you're not paying any extra attention to something that you don't necessarily like. So a skill we're going to go over today is called the ignore.
Right.
Now, and there's specific ways you can do this. So this is going to be really great, right, Nicole?
Right.
So that we're not giving that extra attention.
Right. And, we've all heard of the classic, ignore the bad behavior and pay attention to the good behavior, right? This is pretty much what this is. So last week we talked about praising the good behavior. So in theory, what this does is increases the good behavior, and when we ignore the bad behavior, it decreases the bad behavior.
Exactly. Well
Just
put.
what we want, right?
That is exactly what we want. We want our kids to listen to us, right? So this is what's going to really help if you can use it consistently and really try hard to ignore the bad stuff and praise and describe and reflect the good stuff. So if you didn't hear that segment, the one we went over, the praising, reflecting, and describing, please feel free to tune in. You got some really helpful information there to help your child start listening to you.
Right.
Yeah.
Okay.
So right now we want to talk about an ignore.
Okay.
And I want to first let you guys know how you can do this. So an ignore could be done with limiting your eye contact. So it's as simple as limiting your eye contact and then all the way to actually turning your back. And that way you're really ignoring them. So there might be times where you're not going to be able to turn your back because you want to keep the child safe and things like that. Right. So that's when you could just limit your eye contact, kind of put your eyes to the side you are not going to be talking to the child during that time.
Right.
However, you're using strategic phrasing through the ignore.
Yes.
Right? And so instead of saying, just directly saying, do this, when they're whining, or stop whining.
Right.
Right?
Because that word stop, Parie.
Ah!
Stop. Oh. Right.
No. I'm automatically. I just want to keep doing what I'm doing.
Right. There's these words that we use with our kids. What are they, Parie?
No, don't, stop, quit, or not.
Do they work? I'm going to go. A lot of times it is, right, Parie? You hear these things, don't do that, stop doing that, quit it, and they're just like, I'm just going to do that more.
And let's face it, when we're at work sometimes and our boss is saying, don't do that, or stop doing that.
You're like, I'm going to do it anyway.
A little part of us really just wants to do it anyway, right? Now that we're adults, we have a bit more self-control, for the most part.
For the most part.
However, when these are kids, so they don't have that self-control. So that's why we're here as the parents and teachers and coaches to teach them. And they don't know yet.
Okay.
So, we are going to practice the ignore.
Okay.
And but before we do that, I wanted to go over the way that you talk during the ignore. You talk to your child in the third person. This might sound a little funny at first, but you would say, and then you'd also combine that with when, then statements, or if, then statements. Now, that might sound a little funny. What the heck does that mean? And so, just a quick example. I don't know if you just want to practice something for me so I could just...
Okay. You want to go? Okay.
But just quickly for the... When Nicole plays gently with the toys, then I can play with her again.
Mom! Look!
I sure wish I could play.
Mom!
She's so good at playing with babies.
Look at my
I have so much fun over here.
Why are you paying attention?
I sure wish. Nicole's so good at doing this with me. I wish I could have her help. When Nicole plays gently with the toys, then I can play with her again. Oh man, baby's having a hard time. Oh, thank you, Nicole, for playing gently with the toys.
Look what I did.
Wow, I like what you made.
It's a spaceship.
Oh, it's great. I love all the colors you use. You made such a great spaceship, Nicole. Awesome. And now we can play together again with baby.
Oh, I like that.
All right, so... I don't know if you were able to catch all that just happened in this clip. And you could probably see better than I could what Nicole, little Nicole over here was doing. And basically she was be banging the toys around.
Banging the toys, being not very nice to them.
And that's probably a common thing at home. They might be throwing things or breaking things. Oh my gosh. It's so frustrating. These toys are expensive.
Right.
What I did was when Nicole plays gently, that's the when Nicole plays gently with the toys, or you could say plays nicely, or whatever fits. Whatever behavior that they're doing that you're not liking, you just say exactly what you want them to do. So when Nicole plays gently with the toys, and then I would say, then I can play with her again. Mm-hmm. So that's the when, then.
Right.
And then you could also say, if Nicole plays gently with the toys, then I can play with her again.
Yes.
So either one of those two would be fine. Mm-hmm. So that's how we did it, and then at the end you would see what did I do at the end there, Nicole, that might be kind of bringing our bond back together.
More engaging, talking about what I was doing, paying attention to me, giving me some, like, the good jobs and stuff, kind of noticing me. Mm-hmm. Right,
so that's the key. I'm glad you brought that up, noticing. So when the child starts complying with what you'd like she started playing gently with the toys, which is what I liked, I turned around and said, thank you so much for playing gently with the toys. And then I praised her right away. It got to be quick, because they're going to go back to what they want to do if they don't feel like they're getting positive attention for that.
Right.
So that's just an easy, really fast way of getting them to comply and listen to you, which is what we want more of.
Right.
So,
okay. Mm-hmm. So with the act of ignoring, this isn't going to be easy a lot of times.
Oh, surely not.
Especially when your kid is whining for your attention. Mommy, mommy, mommy. And you're like, and yeah, that's going to happen. And you're going to get frustrated. And sometimes we're going to give in just to make them stop doing what they're doing.
Good point. I'm glad you brought that up.
Right. Because at first it does stop the behavior when we pay attention to it.
Yes.
But what does it also do?
Well, it lets the kid know that, it's okay that they did it.
Right. And if I keep doing this, you're going to pay attention to me. So it really reinforces the behavior. It doesn't actually eliminate the behavior when we kind of pay attention to those things that we don't want.
It's kind of like a quick fix, but it's really not a fix. It ends up making things worse later.
Right. So it'll take some practice, and every time you're not going to be able to do it every time. I wouldn't be able to do it every time.
Oh, surely
Sometimes you're just having enough. Whatever's going on,
this might not be the skill you need to use for all the time, but it could be a skill that could be helpful for you guys to utilize.
So just know it takes some practice.
Yes.
Have some patience with yourself. And if it doesn't work every time, if it doesn't work for you every time, you know what? That's okay.
And when you have your back turned or you're averting your eyes, I did turn my back so I could show you guys how that worked. And you can also just avert your eyes as well. Right. And the other thing is you can take a deep breath when that's happening, because often this whining can get really frustrating. You just kind of want to...
Yes.
So I just really tried to stay focused on, and I made my play, what I was doing over there, really fun. Something that Nicole, I knew about her. She really likes playing with the baby doll. So I was playing with the baby doll, and I said, I really wish Nicole could help me because she's so good at helping me with this. You make it really fun. Something that they're going to want to do. And that's going to lead to them complying.
Right.
So that's another thing that I did during that. So you want to make your play really fun. You want to talk to them in the third person. And you want to use if-then or when-then statements. As well as averting your eye contact or turning your back.
Right.
So, yeah.
Okay. So sometimes when we don't want to use an active ignore, Parie?
I'm glad you brought that up, Nicole. There are some times that maybe might seem obvious when I bring it up that you may not want to use it, but it's important to just let you guys know. For instance, if your child, maybe you have a few children, and there might be just really going at it pretty violently with each other, that would not be a time to use the ignore, because you need to intervene quickly.
Right.
That wouldn't be the best time to utilize it, and your children may not be safe in that moment, and so then we can use other strategies that we can go over in another segment.
Right.
So that would be a really good time to use something else.
All right. Don't, if your kid's climbing on the furniture, jumping off tables, that's, we don't want that behavior to keep going, but at the same time, we probably don't want to ignore that either. And, and
we actually have another segment.
We do.
Yes, about limit setting with
and
the ACT model.
There you go.
So that will be a really good segment for you to watch, so you can have a few different weapons in your arsenal, if you will. So that was the ignore, and we practiced that for you so you guys could kind of get an idea for how it's done. And now that you kind of know how to ignore the stuff you don't like, then we kind of want to quickly go over how you can tell your child what to do in a direct manner so that it's clear to them exactly what you want. Okay, so those are called direct commands. And there's some things you really want to consider when giving direct commands. You first want to consider the age of the child and giving them commands of things they can actually do. So if you're giving them something that might be a little too hard for them to do, and sometimes I know this happens because we're trying to help our children grow developmentally and get to different developmental milestones, and you want to do that gradually because, of course, that's important. You're modeling for them. Yes. And if they really can't do it, not the best time to tell them to do something they really can't do, because that's just going to create frustration, and then you guys are maybe a tantrum, and that's never fun for anybody involved. So that's something that's going to be really important, to be developmentally appropriate and to be very specific with what you want. Instead of saying something like, behave.
Right.
I don't know who this have person is, but I've heard this a lot. Behave. What's go great about have?
I thought my name was Joey.
I know.
Why do you want me to be someone else?
Behave. I don't get it. So instead of just saying behave, and then often parents will say, they know what it means.
Right.
And maybe they really don't. And maybe in that moment they're so fixated on what they want to do that they really need to be told specifically what to do.
Right.
And you need to break it down.
Right.
Yeah.
And this is again where we kind of get into where we either say, behave. We say, stop doing that.
Yes.
Quit running. Again, this is where we want to tell the kids, what do we want to see instead? Well, if I'm not running, what am I supposed to do?
Right.
How am I supposed to get from A to B?
Yes,
You know?
exactly. I'm so glad you brought that up. So instead of saying, don't run down the hall, you would say, please walk down the hall.
There you go.
So the child knows immediately what to do. When they start hearing no or don't do that, immediately they're becoming defensive, and
Right,
often they're not even
exactly.
listening to the rest of what you're saying. And then you kind of go into, did you hear me? Didn't you hear what I said?
Right.
And then that just gets into a power struggle, and then the tantrum happens. We all know what happens after that.
Nothing good,
Nothing
usually.
good comes of this.
No.
So that's going to be a really important thing to do, to tell the child what to do instead of what what not to do.
Right. So one way that I like to look at this, when I'm using it, is talking more in the positive rather than the negative.
Yes,
It's not only about
yes.
don't do this,
Yes.
or, it's using more positive language.
Oh, that's a good point. I like that you brought that up. So saying things like, using manners, please,
Yes.
and thank you, and great job, and very good, and having
Right.
an enthusiasm.
Right. It's sort of like, thank you for using your fork instead of, please don't eat with your hands. It's more...
You know better than that.
Right. It's a little bit more negative, and so we use more of a positive.
And that, it's not going to happen all the time, guys.
No.
Okay? So,
No.
what we really need is to do it as much as we can.
Right.
And you also want to be authentic.
Yes.
Right.
Yeah, exactly.
So,
All right.
if you're just having a bad day, it's going to, that's okay. That's going to happen from time to time.
Right.
And you just can do the best you can
Yeah, exactly.
with this stuff.
And nobody's perfect. We're not perfect.
Surely not. Surely not.
Our kids aren't perfect, so everyone's going to, have their off days. Everyone's going to make mistakes. But, in the end, we all, moms and babies and dads and kids all love each other. And so it's going to be okay in the end. And then we'll get back on it.
Yes. It doesn't undo the positive work you did before. If you just make a mistake, as long as you just get back on track at some point,
Move forward.
it'll be great.
Okay.
So that's some really important components for a direct command. And some other components are to give commands one at a time.
Yes.
So instead of giving a string of commands, like go brush your teeth and then clean and then put your clothes away and then get your pajamas on, that's too many things in a row.
Yeah.
And they may remember the first command and the last command, or maybe just one out of all of them, and then forget the others, and then it just trouble ensues from there. So giving one at a time commands, and then following up and making sure they follow through on what you're telling them to do, and then giving another command. This is not to say that your children don't need to do what you tell them to do, because they do. It's just a manner of strategizing. So it's less headache for everybody involved, right? So we just want to go into just quickly practicing how to do a direct command. The last thing I want to go over is that instead of asking,
Right.
you are telling them. So so instead of saying, let's go ahead and practice this, and then you guys can kind of see what happens.
Okay.
All right.
All right.
Nicole, can you hand me the orange triangle? Did you hear me? Can you hand me the orange triangle?
Mom, I'm doing something. I'm going to use it anyways. What do you want it for? I need it.
Nicole, please hand me the orange triangle. Thank you so much for handing that to me. I love it when you listen to me. Okay, so I made a big blunder there.
Right.
Yeah. What I did was I asked her to give it to me. And what does that lead to? She can easily, as she did, just say no.
Right.
And guess whose fault that is? That's my fault. That's not her fault. I asked her the question. She can give me whatever answer she wants.
So we don't want to leave that door open
No.
for them to be able to say
Let's
no
not,
to us.
And I know sometimes it comes out of wanting to be polite or, not so...
This is what we do in our everyday life. We're always asking permission to do pretty much everything,
And you're the parent. You're the one in command and control.
So we're not asking the kid anything. We're telling them what we need them to do.
And yet, when I told her, I did not say it in a negative or demeaning manner.
No.
How did it go for you when I said it?
It was good. It was,
And I said the word please. So I said, Nicole,
Polite.
please hand me the orange triangle.
Right. So she's still being polite. Because she's not asking doesn't mean she's not being polite or that she's being rude because she's telling me what to do. She is still being polite and being respectful of me as a person. Respectful.
Want for our children to do with other people too. If we can model how to be polite and how to say things nicely, then often kids really do copy what we do, right?
Yeah.
So they're going to copy that.
Right.
They're going to copy that. And then they're going to be polite. The
Right.
teachers are going to be like, wow,
Right.
your child's so polite with the other kids and with me. So that's the outcome we all want.
Right.
So that is how to give a direct command. So the key points are to, make sure it's something that the child can actually do, to make it very specific, to make them one at a time, and to make sure you're telling them and not asking them.
Right.
And making it something, you want to add one more?
I do, actually,
Yes.
because you did something afterward.
Yes.
Well, you did two things,
Oh,
actually.
yes, I did. Thank you for bringing
right.
that up.
You kind of
Yes.
threw in some of those other skills that we've learned right into all that.
Nice catch, Nicole.
So when
Yes.
I didn't comply the first time, she just pretty much ignored me. She stayed calm. She didn't get frustrated. Like, I told you to hand that to me. Why didn't you do that? So she ignored me. The second thing she did was that when I handed her the toy that she wanted, and when I complied, she gave me a specific praise again. So tell me that I did a good job, and again, reinforcing the positive behavior.
Right.
So.
Just like in the ignore, immediately I gave a praise after she started complying. Same thing. I'm so glad you brought that up, Nicole. Same thing with the direct commands. As soon as they comply, you want to give them a big enthusiastic praise, especially at first when you're first learning it. That's going to really motivate them to keep listening to you.
Right.
Yeah.
Okay.
All right. If you have any more questions, of course, go to our Facebook page, Parenting Corner, or just send us an email.
Yeah.
You can go to our website at www.postpartumrelief.org.
Yeah.
Thanks so much for coming.
Yes, and we'll see you next time.